And welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's top news. AI-powered surgery at Indraprastha Apollo Hospital restores 83-year-old's quality of life. In a remarkable medical achievement, Indraprastha Apollo Hospitals conducted a successful Indocyanine green AI fluorescence-assisted gallbladder surgery on an 83-year-old patient, alleviating severe abdominal pain caused by gallstone disease and a large hernia. This accomplishment underscores the potential of advanced medical technology in elderly patient care. The patient had been suffering from intense abdominal pain due to a complex medical condition involving gallstone disease and a sizable hernia. Initially, surgeons in Kolkata had planned surgery but encountered an unexpected and life-threatening obstacle during the procedure. The patient's liver was filled with cysts, making gallbladder localizations unsafe. To prevent potential complications like severe bleeding, the surgery was halted. Undaunted by this setback, the patient sought a second opinion in New Delhi and consulted Dr. Arun Prasad. Recognizing the significant impact of these diseases on the patient's quality of life, Dr. Arun and his team took on the challenging task of anesthesia and surgery. To talk to us in detail about the procedure, we have with us on board today Dr. Arun Prasad, Senior GI, Bariatric and Robotic Surgeon at Indraprastha Apollo Hospitals. Welcome to Medical Dialogues, Doctor.
Thank you.
So, Doctor, can you describe about the case?
Okay, so this was an 83-year-old gentleman who was suffering from gallstone symptomatic. He was having pain and he required regular painkillers. He also had a large incarcerated inguinal hernia with the sigmoid colon stuck there. He was advised surgery in Kolkata, but during the laparoscopy, it was found that he had lots of cysts in his liver and they had blood vessels over it. And amongst the cysts, somewhere hidden was the gallbladder. So the surgeon there, for safety reasons, decided that it's not worth risking any injury or causing any bleeding because that could be quite life threatening in somebody of his age and his medical background. So surgery was abandoned. Then he approached me in Delhi for both his pain in the groin region where his sigmoid colon was stuck, as well as for the gallstones. So at that time, after seeing his scans and reports, what we felt was that we could use the technology which we have on hand, which is of using the Indocyanine green fluorescence, because we have our laparoscopic sets where we can actually change the image and see the vascularity of the operative site using the dye. So we proceeded with the surgery, and during the surgery, after giving the dye, we could quite easily demarcate between the cyst and the gallbladder, and we were able to locate and identify and safely pick up, dissect the gallbladder off without touching any of the cysts, and also at the same time we were able to do the laparoscopic hernia repair of his obstructed sigmoid sliding hernia. So this is in brief what the procedure went like. He was kept in ICU because of his age, hypertension, and medical conditions overnight, but within 24 hours he was quite fit.
Right. So, like we talk about, so what were the specific challenges and considerations your team faced while performing complex surgeries, and how can advanced technologies like AI assist in addressing these challenges?
So there were two challenges. One was the challenge to my anesthesia team in view of his age, hypertension, and other medical conditions. Also, the fact that he was going to undergo two surgery for which we didn't know how long it will take. So they were fully prepared with all their armamentarium and their technology. So then, from the surgical point of view, in such cases, we do face the danger of damaging any of these congenital cysts or hemangiomas and cause bleeding. Sometimes some cysts may not know, they may be actually communicating with the biliary radicals, and you can actually create a biliary leak or bile peritonitis later on. So the technology which we've been using it for quite some time now, and it's used. One is to demarcate the blood vessels, which we use for all kind of GI surgery that I do, and it demarcates both the major blood supplies. Sometimes it shows us blood vessels, abnormal blood vessels, which are not supposed to be there. And at the time of, say, anastomosis, we are able to see how good is the vascularity of the intestine which we are trying to anastomose. There are various uses of this technology which is there, and it just goes to show how technology is making surgery safer for the patients, and also it is helping us take up more difficult cases with experience and confidence.
Right. So, Doctor, this case highlights the use of AI and fluorescence technology in gallbladder surgery. So, can you explain how AI assisted surgery is transforming the field of medical procedures?
Okay, so now the AI is coming in various areas. So it's not just the surgery, it's also the pre-surgery workup where we are uh, able to use AI, in the sense that if the data is fed, which has the patient's details, age, underlying medical conditions, background, family history, their blood reports, like what is their kidney function, how well is the blood pressure control, the diabetes control, then the extent of disease. All these data can give us a better assessment of the risk of surgery which the patient would be undergoing. Also, the patient can be informed beforehand as to what all we are expecting and what problems can occur and how we are going to plan. So it just helps us in planning better. It's not like we were not driving from, like I live in Noida, from Noida to uh, Delhi airport earlier, but with Google Map, one is able to plan better and maybe take routes which make the driving more efficient, and I'm able to reach much earlier. So AI is only there to help us in our planning and to reduce problems and complications. During surgery, as I mentioned, this was one example, but the like I do robotic surgery. In robotics we have the robotic staplers which can actually feel, they can feel how thick the tissue is and guide me as to what kind of stapling I should be doing. It tells us we've got staplers with various heights. So 3 millimeters, 4 millimeters, 5 millimeters. So after gauging the tissue, it tells us what kind of stapler would be best suited for this particular tissue for the anastomosis. Even when the stapler is being fired and the tissue is being stapled, it pauses, it compresses the tissue based on the feedback it gets from the tissue. So this goes a long way in attempting to reduce two of the dreaded complications after any anastomosis. One is anastomotic site bleeding, and second is anastomotic site leakage. So these are, what in AI terms you would say first generation or AI grade one assistance. The robotic surgery is a master slave. So that's zero because there's no AI involved. It's like driving a car. But as soon as you start getting a feedback and suggestions from the robot, then it becomes a situation of AI. Then, we can actually superimpose images over the actual surgical site, and then it will tell us the more about the pathology of the tissue which we are operating. So it's a long thing. Post operative, after surgery, with all the data fed, including the data of the surgeon, the history of the surgeon, the record of the surgeon, his past results. The AI can even, at times tell you that, okay, such and such complication, chances are high that this will occur on the fourth day based on the patient data, the surgeon data, and the way the surgery has gone. So, tremendous scope.
Right. Thank you, Doctor. Thank you so much for your insights.
Thank you.
The case was managed extremely well with tremendous efficiency and expertise of Dr. Arun and his team. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.